Hey everybody, this is Dr. Ben Pearl with FitFootU. So today we've got a lot of things going on with healthcare, and I'm here with Craig Thompson. He's a healthcare specialist who's served on many local Medicare panels in Arlington, Virginia. So we've got a lot going on, Craig. As I mentioned at the top, December 7th, Pearl Harbor Day, is the end of open season for selecting an alternative Medicare plan. That, coupled with the disarray that has happened and confusion with various Medicare Advantage, or as we jokingly like to say, disadvantage plans and their associated affiliates, and we've got a new administration rolling in January. What do you make of all this?
That's right, Dr. Pearl. So we have Dr. Oz now proposed to be the lead and the head of CMS at HHS, and he's actually been a large proponent of what he's previously called Medicare Advantage For All. As you pointed out, we only have a few more days left in open enrollment. The Medicare Advantage plans have been trimming their benefits quite rapidly because their medical loss ratios have gone up by several hundred basis points, which has caused them to actually, what's known as, in Wall Street parlance, miss and guide down expectations going forward. So as they reduce these benefits and freebies that they've been offering over the past 20-odd years.
Groceries, for instance,
groceries,
$150 of groceries.
And then we have the give back benefit on Social Security or medical transportation. We've got acupuncture.
You just mentioned on that point, you were at a bus depot and saw on the bus waiting area something targeted to the veterans. What was that all about?
That's right. So we had Humana specifically targeting veterans with a particular Medicare Advantage Humana plan that can either back up or act as primary, with its VA being secondary. And that way it's allowing the VA to voucherize a lot of the care that the VA feels that they cannot themselves even tolerate with caseloads that are too big. So managed care has made a sales pitch to the VA accordingly, saying, hey, we can reduce your expenses and costs and let us kind of take this off your hands.
So what is the risk, Craig, with this shell game? What happens once you choose one of these Medicare Advantage plans? What could happen?
People are getting sticker shock with a lot of out-of-pocket expenses that they previously thought were covered. They're getting phone calls from providers who used to be in-network, whether those are acupuncturists or other providers that have not been paid for services already provided and rendered. And they're getting billed for x-rays and things that original Medicare actually pays under the original fee-for-service model, but the managed care model is actually now rationing quite rapidly as they underestimate the utilization rates of a more chronically sick population.
Could you get kicked out entirely with one of these new plans if you're not, if you're sick? If the risk ratio becomes too high, could you get kicked out? Or
you actually get phone calls from what's called their utilization management department, where they realize how expensive you're getting. They offer to provide what they call case management and care coordination, but their real rationale is to lower their costs, and then they're pulling out of markets that they feel are not profitable. So you have entire regions of the country, certain counties, where the selection and choices are getting narrower and narrower, and actually providers are now going out of network with Medicare Disadvantage because they have actually not been paid, and they have, quite frankly, been stiffed in a number of cases for services that they already provided.
So let's finish it with this. We've got the inaugural coming up next, in 2 months, we just hit December, so really next month. What do you predict, other than we've already seen our 401ks take a nice positive turn? What do you think is going to happen under the new administration with healthcare? What's your prognostications?
The concern is that Dr. Oz is very closely allied with what he's previously advocated as Medicare Advantage For All, and he's now trying to rebrand as Medical Advantage For All, which would be more of a wholesale privatization of the original Medicare model as supposedly a cost-saving mechanism for Medicare. And he himself has a portfolio that's got a lot of privatized Medicare companies, and even United Healthcare common stock has been reported to be in that portfolio.
Which he's had to probably put into some kind of private trust that is separate so that he can continue his civic duties.
Yes, yeah,
confirmed.
that's right. It's quite common for political appointees to move their assets and investment portfolios into a blind trust, which has limited power of attorney given to a financial advisor and a planner who will then actually indemnify the client from any liability associated with front running or stock picking and things of that nature.
Well, Craig, you've got a couple resources to help us through this maze and confusion. What are they that consumers can take a look at to help them make an informed decision?
Well, we've got, certainly we have Becker's Payers Review, we've got Healthcare Dive. Axios is also a local resource that was founded by former Washington Post reporters who initially had branded or rebranded themselves as Politico. Axios is following these developments quite closely in addition to those two other newsletters.